Well, we're going to talk about inflammation. I said, oh, my foot's inflamed. Well, here is the example of gout. And what you notice, it's swollen and it's become red and it gets painful. If you touch it, it's usually hot. You can actually get inflammation of the organs. And one here's an example of an inflamed organ. But this one with the foot, you can actually see the effects of it. So, what is inflammation? When your body encounters an offending agent, like a virus, bacteria, or toxic chemicals. And with the gout situation, we were talking about that toxic chemical was uric acid, because the uric acid crystals form in the area and they impregnate themselves in amongst the connective tissue and in the joint. It gets very painful. So inflammation activates the immune system. So the immune system comes to the rescue to try to fix things up. Now, your immune system sends out first responders, and this with the immune inflammatory cells, which we'll look at them. They're the white blood cells, they're called the neutrophils, they're macrophages and other kinds, but also secretes chemicals called cytokines, which actually got jobs of stimulating more inflammatory cells and doing other things to the blood vessels there. These cells begin an inflammation response to trap bacteria and other offending agents or start the healing of the injury of the tissue. The result can be pain, swelling, bruising or redness. So that's the type of stuff. Now here is a very, very simple example of what happens when you get a splinter, and the splinter initiates an inflammatory response. The splinter may have more than likely the fact's got chemicals on it, might even have viruses, bacteria or fungi on it. But here is the inflammatory response on this side. See the swelling of on this side here, that's the injury, the inflammation. It's swollen, it's painful, it's warm, redness, and the blood clot forms. And this just shows you the microcirculation here, which is the capillaries. Capillaries enter the white blood cells, neutrophils, etc., come in and to try to stop the invasion of whatever is coming in. And here is a more diagrammatic situation, because this one here doesn't show it. But what happens, the capillaries widen, they dilate. So you've got increased blood flow. So you've got more blood flow into the area and it becomes hotter and redder. That's what these are. And so it releases fluid into the tissue there from the capillaries. So it swells up. The next thing is where the white blood cells start the fight. It becomes tender and painful because of what is happening there. Now here is a better diagram of this diagram shows you a pathogen entering the wound. The pathogen could be a virus, a bacteria, fungi, any other microorganism, but let's assume here it is the uric acid crystals. And so you have a process going on here where let's look at the mast cells. They release chemicals, cytokinins, which make the blood vessels leakier. See them part here, they become more, so increases the permeability is the better term. And so the white blood cells here can sneak into, and in this case here, the neutrophils, and they phagocytose. That means they take in, they eat it up, or engulfing is the other terminology. Here is a macrophage in the process of engulfing this microorganism, or it could be, let's call it the uric acid crystal. And also the macrophage here also releases chemicals which increases the permeability. So that every little component part here. But eventually this has to stop once it finishes, once you get over the danger. But sometimes the inflammation continues even though there's no more danger, and it can spread to other parts of the body. Now what starts this inflammation here is the next part, which is really much more advanced. And here, this is the thing that starts it. This thing is called the inflammasome there. And there is a structure there. Let's magnify it so you actually can see it. So the inflammasome there, look at it. It's a very, very complicated protein. A lot of proteins made up of them. Here they are. and you can see them, what they are. I won't go through them because it really is a complicated process. So, I'll read it. When the body becomes inflamed or unwell, there are many biochemical responses which are activated, including the immune response, which we talked about there. There's part of the immune response there with the neutrophils phagocytosing the invading part. Blood clotting and the response, and then inflammatory response. So this thing here is the whole inflammatory response there. Now, a multi-protein oligomer. That's this thing that this is the word that they use in oligomer, which is huge. It's a big protein, right? It's not. It's actually a multi-protein. It's made up of many proteins. You could see it there. A molecule consisting of many protein subunits, and you can see them red, yellow, there. And that's called the inflammasome. This thing, right? And inflammasomes were only discovered in 2010. So my uni days, I know nothing about them. It's only recently. Now, how is the inflammasome formed? Well, the inflammasome, that's this here, this complicated series of proteins, is triggered by a range of substances that emerge during infections. So an infection can trigger that off. It is a complicated mechanism how it triggers off tissue damage or metabolic imbalances. But you might have too much of one particular substance in there. And this example here is uric acid. Now, once the inflammasome has formed from many protein complexes, the many protein complexes are all these different ones up here. So that's what I've written there. And then it begins its job. Well, the inflammasome activates a range of powerful proteins, capsule 1, and here it is up here, capsule 1 here. See there? Pro-capsule 1 and so then capsule 1, which also bursts open, right? And it releases what we call proteolytically activates. Proteolytically means that it makes it break open, it lyses it, and it releases pro-inflammatory cytokines, and interleukin 1 beta, interleukin 1 beta 3, and interleukin 18. There's a lot more other. Now, these powerful chemicals here perform various jobs. What they normally do, some of them do go and make holes in the membrane of the bloody cell, and then the cell bloody bursts and it releases all the other chemicals in there, and then the cell dies. It's called pyroptosis. Pyroptosis is a Greek word. Now, other proteins that, apart those that make the cell leak, have released, and they signal the macrophages and the immune cells and the white blood cells, neutrophils, to arrive and mop up and eventually stops. So in other words, these cytokines signal these guys to come along, this one, and that one, and they do their job. All right? Now, so getting back to this, and it stops. And that's what you want it to do. Once the danger has been removed, you want the inflammation to stop. Because these cytokines that they release, they're quite powerful chemicals. They actually destroy other good cells there in the area. But if they escape from that local area and go to other parts of the body, then you're going to get a big problem. So it stops. If it doesn't stop, it continues to lead to organ damage or disease. In other words, if the inflammasomes with their cytokine chemicals are released, then you'll get problems which we call an acute inflammation, a chronic inflammation. See, acute inflammation is like, for example, such as when you cut your finger to heal it, and your body sends inflammatory cells and it starts healing. Now, chronic inflammation, your body continues sending inflammatory cells even though there is no outside danger. In other words, the cells keep migrating to other parts of the body, and also the chemicals associated with those cytokines. Now, for example, in rheumatoid arthritis, inflammatory cells and substances attack the joint tissues, leading to inflammation that comes and goes, and can cause severe damage to the joints with pain and deformities. Not shown so, but that's only with what we call with the bone. But look at all the other types of chronic inflammation. Cancer is a type of chronic inflammation, because there what is happening is all those chemicals, they are continuing to continue the inflammation, but the inflammation is pretty destructive in itself. You've got neurological diseases like Alzheimer's, Parkinson's, multiple sclerosis. That's because of chronic inflammation, because it hasn't stopped the inflammation. Pulmonary disease, asthma, COPD, hay fever, bronchitis. We talked about this one here. Metabolic disorders, type 2 diabetes, renal failure, fatty liver disease, cardiovascular disease, atherosclerosis, heart failure, stroke, etc., and the autoimmune diseases. Now, on this next diagram, he just shows you the red side. That's the acute side, right? And it just gets resolved pretty quickly. But the chronic side is what I talked about here. We can go to other organs over a period of time. This is a pretty simple diagram. It's got body pain, constant fatigue and insomnia, depression, anxiety, mood disorders, problems with digestion, weight gain, frequent infections. But they're only just simple things what they have written on this diagram. But this is really the problem here of this chronic inflammation in here, affecting whole body systems around the body. Here is an example of acute versus chronic, like allergy, like a bee stings you, it's resolved very quickly. Chemical irritants, like even an ant sting puts formic acid. You get an infection through a splinter or something. Trauma, you damage the tissue by banging yourself. Burns, lacerations, cuts, wounds, and frostbite. These are pretty acute, but it could lead to chronic if the acute inflammation doesn't stop there. And here are again some of those others, these over here that I mentioned. This diagram's got a few others here. It's got cancer, lupus, fibromyalgia, chronic fatigue syndrome, rheumatoid. So all of these are consequent of chronic inflammation, the damage that they do. Now I'm going to talk, I'll stop it here, because the next part I'm going to go to is really what happens with the uric acid crystals, and that will be the second part of the next video.